Good morning, everyone, and welcome to This Week in Cincinnati. I'm Craig McKee. First today, the heroin and opioid crisis here in the tri-state, and a new report actually just out from Butler County. Butler County coroner Dr. Mannix says that her office handled 232 overdose deaths in 2017. Now, that is a 21% increase from last year, and 82% of those overdose deaths were related to heroin, fentanyl, and also what are known as fentanyl analogs.
I'm hoping that 2018 will be better. As you can see, it's almost a moving target in terms of the drugs that we're seeing, the additional mental health issues that go with it. So, I mean, it's a big beast.
Of course, that's Dr. Mannix speaking there. Joining us now, Dr. Mannix live here in the studio. Thank you so much for joining us. When you look at those numbers, a 21% increase in overdose deaths, are we at that peak yet, do you think? Are we curving any type of a corner on this epidemic?
Well, the trend keeps increasing, so I would hope that it would decrease, but I don't see that happening yet.
A lot of people obviously hoping for that. When we mentioned the analogs, the fentanyl analogs, obviously, you know, in the beginning, opioid medications, and then you have heroin, and then heroin's not enough for people that their tolerance has gone up, so then it's, you know, fentanyl increase, then carfentanil. And where are we going on this? What are you seeing in your office, in the coroner's office, when you examine these folks who have overdosed? What are you seeing the most of now?
Well, certainly you're right. We used to see heroin, mostly heroin, and then it transitioned to fentanyl. And some of that, I think, is availability, right? It became very popular, very easy. It's synthetic. And then in 2016, middle of 2016, we saw the introduction of these fentanyl analogs. And they are just unpredictable in their potency, in their chemistry, in how much a person gets in a particular use, and they're deadly.
And fentanyl analogs, for those who are watching, this is the combination of all the drugs together?
Well, it's actually a variation on the chemical compound of fentanyl.
Okay.
So you take the chemical structure and alter it just a little bit, and it makes it a different drug. Same base formula, but has a little bit different chemical quality and maybe a different impact on the body.
We obviously just had a huge bust, federal, state, local authorities all combining, tied to fentanyl, and these operations tied to the Sinaloa cartel in Mexico. Obviously that's a silver lining. You see that headline, you go, okay, great, they're making some sort of headway, but there's no doubt that heroin, fentanyl, carfentanil, it is here, and you're still seeing it, and it's not going anywhere anytime soon.
That appears to be the trend. And as these new analogs come along, maybe fentanyl will not be the common thing. It'll be mostly analogs. I mean, we saw that 20% of those deaths, those opioid deaths that you talked about, had at least one fentanyl analog in them. We also see an increase in methamphetamine in the toxicology and the deaths that we see. So it's a moving target.
Right. And methamphetamine has been mentioned more recently, and that was something even a year ago law enforcement told us the next thing around the corner is probably going to be meth. That's what they were hearing, and here it is now. So
it is.
It's kind of reoccurring. It's like the 80s styles coming back. Now meth has come back in that cycle.
Right. So, and I think that's it. There's probably a cycle to it. I would love for it to be a cycle that comes full cycle, so that the treatments and the plans that we're implementing now on the opioid crisis are actually effective. I'm afraid that the moving target moves away from that, and we're always one step behind.
Governor Kasich has said that the progress is being made. Do you agree with that statement, when progress is being made towards the opioid epidemic, and at what level do you see progress actually being made?
In Butler County, we have lots of community partners and agencies that are trying to improve the situation, and there are so many different factors in it. I mean, you have your law enforcement aspect, you have the EMS, you have, you know, families that are fighting it, you have treatment, you have the hospitals, and all these folks. So everybody's got their part to play, and we all have to take responsibility on that. We have to influence the area that we are able to influence, whether that's education in the schools, whether that's disposing of your medications properly. I mean, everybody has a role so that we make progress.
And obviously, and sadly, your office, and you yourself, you see the end result of the epidemic. And when you look again at 232 overdose deaths in 2017, are you seeing, I guess, how do you break down those overdose deaths? Are some of these first time? Is there any way to indicate, are these first time users? Are these long time users? Are they young? Are they old? What are you seeing in this epidemic?
Well, as you mentioned, we're the last stop on a very bad journey. And we're only a fraction of the people who have a problem with opioid addiction. There are many more out there that are being revived repeatedly, that are trying to get into treatment. And so that small piece of it gives us some glimpse. The deaths are actually occurring primarily in white men. The median age of death is around 38, 39 years old, so it's a little bit older population. But we know that we've got to get that message to kids. We've got to get that to people sooner, so that although we may have trouble reaching the current generation that's dying, hopefully we prevent the next generation from even starting using.
And we're just seeing these numbers from 2017, I guess. Where do we stand right now? Here we are in March. Where do we stand the first couple weeks of not only March, but I guess actually 2018? Where do we stand in Butler County with overdose deaths right now? Our
overdose deaths are on pace for 2016 numbers, which would be a decrease, but it's so unpredictable. Month to month, we don't know what will show up on the streets, the potency of it, how many people are using. So it's Russian roulette, and it changes every day.
Well, fingers crossed that that decrease is a positive sign and that in the long term the numbers do start going back down. Dr. Lisa Mannix, Butler County coroner, thank you so much for joining us. We're going to continue to follow the opioid issue and the epidemic here in the tri-state.